Chilblains. Chilblains. Cold-induced inflammatory cutaneous lesions, occurring to capillary beds in the skin, most often in the hands or feet. Symptoms. When blood perfuses into the nearby tissue, it results in redness, itching, inflammation, and possibly blisters. The lesions may be erythematous or purplish in color and may be either macular or papular. Causes: exposed to cold and humidity. Risk factors: female. Treatment: avoiding cold, damp environments, wearing gloves and warm socks to keep the feet in hands warm. Types: idiopathic chilblains, primary chilblains, caused by exposure to non-freezing and damp conditions. Secondary chilblains, due to an underlying connective tissue disease, CTD, monoclonal gammopathy, or cryoglobulinemia, kibes. Ulcerated chilblains. Familial chilblain lupus. Autosomal dominant form of lupus erythematosus caused by heterozygous mutations in TREX1, mostly in Asian populations, that typically presents in early childhood. It manifests cold-induced, bluish-red infiltrates on peripheral surfaces, which are painful and tend to ulcerate. Diseases that show similar symptoms: Raynaud syndrome. Arterioles in the skin become narrow, limiting blood flow to affected areas. Vasospasm. Feels numb and cold in response to cold temperatures or stress. Erythromelalgia. Usually triggered by increased body temperature. Frostbite. Damage to skin and tissue caused by exposure to freezing temperatures, typically temperature below -0.55 degrees Celsius. It most likely affects the extremities. Trench foot. Immersion foot syndrome, results from the feet being wet for too long. For example, in cold, wet conditions in trenches without the extra socks or boots to help keep the feet dry. Vasculitis. An autoimmune disease that causes inflammation and narrowing of blood vessels, triggered by an infection, a medicine, or other causes. Systemic lupus erythematosus, SLE, an autoimmune disease linked to environmental, genetic, and hormonal factors. Embolic event. Sudden blocking of an artery by an embolus that has been brought by the bloodstream. The embolus is most often a blood clot, but may be a fat globule, air bubble, piece of tissue, or clump of bacteria. Aicardi-Gouttières syndrome. An inherited encephalopathy that affects newborn infants and usually results in severe mental and physical handicap with chilblain-like symptoms.